Okay, well, when I'm not seeing patients in the clinic, I'm spending my time in my lab. As I think I mentioned yesterday, I really do visual cognitive neuroscience. Because I like to, for me, what's really drives me in the research world is what does the brain do and how does the brain process vision? And I'll tell you the single biggest advance in the last 30 years in cognitive neuroscience is fMRI. Now, I'm not going to advertise this as a clinical tool that you're going to be using right now to see patients. That day probably will come, and it's not that far off. Right now, it's mainly a research tool, but we're learning incredible amounts about how the brain works through the use of fMRI. And the growth and the use of this technique has been really astonishing over the last 10 years. For most of you who are ophthalmologists, you may not think a lot about MRI. And so what I've tried to do with this talk is give you a basic introduction. I'm not going to tell you about all the ways and all the things we've learned about vision through using fMRI, because that's just far too large a field to cover. What I want to do today is to give you a bit of the basics so you can understand how fMRI works, some of the ways in which you analyze fMRI data, and what that can tell you about the brain, so that when you see these papers in the literature coming up, you can understand what exactly is going on in them, and hopefully it won't seem quite so intimidating. So, to understand how fMRI works, you do have to understand a little bit about how MRI works. And Andy's done a nice job of introducing a little bit of that. I'll try to do a bit more of that as well. So we're going to start off with that, understanding the basics of how fMRI and MRI works, primarily what we call the BOLD signal, or blood oxygen level dependent signal. We're going to talk about some standard fMRI methods that we use right now and have been using the last 10, 15 years, the block design methods and the event-related designs. What does that mean? And then where this is going to go, some of the sophisticated new methods that we're using to look at fMRI data, which include things like fMRI adaptation, multivoxel pattern classification, sometimes known as mind reading, and connectivity. How do these networks work together, and can you see these networks in the living brain? So, how does fMRI work? Let's start with the basics. Andy talked about the single. You can actually do MRI on any kind of element or atom in the body, but we use hydrogen. It's a single proton. It's got an uneven charge on it. It's got this plus. It has mass. The fact that it has mass and has this electrical charge gives it both angular momentum and magnetic moment when it's spinning. Okay, and that's the whole basis of this, is detecting that spin. If you put these rotating magnets into a magnetic field, like you imagine it as a magnet bar with a north and south pole because of the magnetic momentum, it's going to align. Imagine you put this magnetic field like this with this B0. These protons, as they spin around like a spinning top, they're going to spin around this long axis here that's going to align with the magnetic field that you put them in. And they're going to align in one of two ways, either this way, which is at the low energy state, or this way, in the other direction, which is a high energy state. And the net magnetization that Andy talked about really reflects how many more are in the low side than in the high side. And that is determined by two things: temperature and also the strength of this B0. This is why having a stronger MRI scan gives you a better and stronger MRI signal. Okay, so if you look at the net moment here, it's in this direction. Now, if you're trying to characterize this in terms of Cartesian coordinates, this B0 lines up with the z-axis, and if you imagine the spinning top around here and project the vector of that spin along onto the z-axis, that's the longitudinal aspect of this net magnetization. If you imagine the spinning being projected onto the xy plane, well, that's the transverse magnetization that's going on. And we're going to need to understand that when we talk about the radio frequency pulses that we use. So if you imagine this, here's the z-axis, and here's the xy plane. We'll just use the y-axis for simplicity in this two-dimensional diagram. What happens is that if you're going to try to figure out what's going on, you have to try to perturb those protons out of that comfortable zone spinning around the z-axis, perturb them out of that, and then see how they decay once you remove that perturbation. So that perturbation is this excitation pulse. The excitation pulse is meant to shift the proton spinning around this to where they're spinning around this one instead. And it's a 90-degree shift from the longitudinal to the transverse plane. When you turn that excitation pulse off, then those things are allowed to relax back to this, because this B0 magnet is still there. All you've done is turn something off and on in this plane. Now, if you imagine looking at how this spinning top, as it relaxes back to from spinning around this direction to spinning around this direction, it kind of looks like this. Imagine a single proton. That means that the vector projection of this onto the z-axis is gradually increasing as it relaxes. As it returns to this z-axis, it's getting longer and longer and longer. That's what T1 relaxation is all about. If you imagine what's happening in the xy plane, though, what's happening to that vector? Well, it's spinning, and it's spinning less and less. It's spiraling in on itself because it's returning to try to spin around the z-axis, not around the xy plane anymore. So as it does that, the projection in the xy plane is getting smaller and smaller and smaller. So T2 relaxation is a decay in signal, whereas T1 relaxation is actually an increase, a return to the strong signal in the z-axis. Okay, so that's should be fairly straightforward. The one thing to consider, though, is when we're talking about these diagrams, we're sort of talking about single protons. The truth is, though, that we can't measure single protons. We measure a bunch of them. And when you have a large sample of protons, not just one, there's something else that goes on with T2 relaxation, and that is, even when you throw in that radio frequency pulse and you flip everything onto the side, they're all synchronized at the beginning. But as you turn off the pulse and let them relax, they're spinning around this direction, but as they keep spinning and spinning, they start to gradually lose coherence with each other. And the best analogy is to think of a bunch of clocks. As you start them off all at the same time here, but if they are running at slightly different rates, then the longer you keep going, the more they get desynchronized with each other. And if what you're measuring is the overall net magnetization in the xy plane, then that's going to, as they start to get more random, the signal is going to decay just because of that random variation that's going on. Now, why did they do that? Why did they get out of sync with each other? Well, one thing is that they interact with each other, so they influence each other, and that's what's called spin-spin interactions. So that's one thing. But the other thing is that there's other inhomogeneities in the visual field, in the area that can also influence the rate at which they spin. These are other paramagnetic elements, and for us, the most important of these things is deoxyhemoglobin. Okay. What we know from this is that there's something called the hemodynamic response, that changes in capillary deoxyhemoglobin can be demonstrated in activated neural regions. If you have deoxyhemoglobin, the more of that you have, the more desynchronization that you have, the faster that T2 is going to relax. And so what you find is that if you create some activity here that's going to make the brain work at time 0, immediately what happens after this is this initial dip where oxygen is extracted from the table because your brain is using oxygen, so there's more deoxyhemoglobin, and so the T2 signal goes down. However, after a very short time, that signal rebounds back up, and you have a very big overshoot, a big increase here to the peak of activity, and that's because in response to the fact that you're using that part of the brain, the vascular system actually delivers a lot more blood. And because it delivers a lot more blood, it washes out the deoxyhemoglobin, and paradoxically, you actually have an increase in oxyhemoglobin concentration and a decrease in deoxyhemoglobin in an activated region. So, and then after a while, you get this peak overshoot. This is what standard fMRI measures. There are ways to measure this, but most routine protocols measure this because this is the larger effect, the paradoxical decrease in deoxyhemoglobin with activity. Okay? That's what the bold signal is. That's the blood oxygen level dependent signal. The fact that you're introducing less deoxyhemoglobin in this area by washing it out with neural activity. So we're not really measuring neural activity when we do fMRI, at least with these protocols. What we're really doing is measuring vascular response to increased activity. Okay, so it's an indirect measure. And some of the earliest demonstrations that this actually could work used the visual system. And so this was Kwong's experiment back in 1992. It's very straightforward. They put somebody in the magnet, and they turned all the lights off. Then they turned all the lights on. Then off and on. And you can see this is like for 60 seconds at a time. 1 minute lights on, 1 minute lights off. And you can see how the signal in the occipital cortex here, here is the light off, on, off, on. You can see in the striate cortex and occipital lobe here, there's all this increased signal, which is demonstrated here in the graph here, when the lights are on, which then goes away when the lights are off. And we know that should happen, and this is a nice verification that you could see this and that you could show that it was specific to occipital cortex. More than that, people have gone on. For example, in Cheng et al. In 2001, did a sort of a slight variation on this, where instead of lights off and on, they put lights in one eye, then light in the other eye, so monocular light stimulation, alternating the two eyes. And what you can do with that is you can actually even show ocular dominance columns in occipital striate cortex, where the purple comes when light is shone in one eye, and the yellow is when light is shone in the other eye. So if you understand that Kwong design, this one here, this actually is the basis of what we call a block design today. A block design means that you have a bunch of trials, all of the same type. They may not be exactly the same trial, but they're all the same sort of stimulus you want to do. For example, it could be, for us, the most common thing is to present a bunch of faces. We show one face, we show another face, we show a different face, and we keep showing faces for the entire block. After you finish that, then you show a block of a different set of trials. And what that different set of trials is depends upon what you're trying to isolate. So if you're trying to show an area that doesn't respond just to objects, but more specifically to faces, what you might use for that second set of blocks is non-face objects. And you can do this over and over again, show faces, show non-face objects, show faces again, show non-face objects, alternating back and forth. And then after a while, you take these and you statistically compare what happens in the brain when they're seeing faces with what happens when they're seeing a non-face object. And you can tell which areas of the brain show statistically greater activity, greater bold signal when faces are being seen than when other objects are being seen. Okay, that will allow you to find a region of interest, a functional localizer, which areas of the brain like to look at faces. You can also do that in a predefined structure if you have a marker to figure out what the area is doing. So for example, this is a study of area MT. Area MT is the middle temporal area. It's on the lateral side of your brain. And we've known from monkey work that area MT responds to moving stimuli. Okay? What you can show here with a bold signal is that you have this paradigm where you have a fixation period, then you show a bunch of dots that are moving, another fixation period, then a bunch of dots that are just sitting still on the screen, and so on and so on. And you can see that what happens here is that only when there's moving dots does the activity go up. When it's fixation, the activity is pretty low. If you show static dots, there's no difference from fixation. Only when there's movement do you actually see this. So here the subtraction would be between moving and static, and that would show you that this is an area that's responsive particularly to moving dots. An event-related design is kind of, for those of you who do evoked potentials, it's a very similar strategy. What you're going to do is you're going to look at what's going on in a single trial, but you're going to average this over many trials, and you can, again, you can do the same thing. You're going to compare trials of one type versus trials of another type. And what you're going to look here at instead is at the hemodynamic response. So if you have one trial type, you show the face here, the activity is going to go up, and then it's going to come back down. Remember that from the HDR, the hemodynamic response. If you show a different kind of trial, activity might go up, but it may not go up quite so much. And the difference between the two is telling you that this area has something special going on with this trial that's not going on with this trial. Okay? So that's a more sophisticated way of looking at this. It allows you to do a few things if you look at trial by trial basis. For example, if you have a trial where you're having a subject actually make a response, if they make errors, you can eliminate the trials that have errors from your data. So that's the basics of how we currently use MRI, block design, event-related design. A lot of what we're interested in now, though, is that when you do a particular task, when a light comes on, when something moves, when you're looking at faces, it's not just one area in your brain that lights up, okay? It's a bunch of areas. We've got networks that are engaged in a specific task or with specific stimuli. And for example, with faces, you can see that if I show you faces, this is from some of our data, you get a core network which involves the fusiform face area here, the occipital face area a little further back, and then around the corner is the superior temporal sulcus. That's the core network for face processing. And there's other areas that also get brought in, like the inferior frontal gyrus and the precuneus. So what we want to do now is shift the focus of research to saying, well, I'm not just caring about whether I get a cortical area, but what are these areas doing? Do the parts of the network do different things? How do these work together? Does the network change? Is it a dynamic thing that changes when you have different tasks and different stimuli? How are we going to answer those questions is what's driving the new ways that we have to look at how we analyze fMRI data. So a couple of points. fMRI adaptation. What's this all about? This is one of the attempts to try to tell you what exactly is this area of your brain processing about a stimulus. So if an area likes faces more than objects, fine. But what is it about faces that's driving that? We can use fMRI adaptation to do that. What this relies on is this kind of strategy. If I show you a face, imagine that in the fusiform face area, activity goes up and then it comes back down. That's the hemodynamic response. If I show you that face again a second time, the response is lower, okay? And the difference between the two is adaptation. It's a kind of like been there, done that kind of response in the brain. It doesn't respond nearly so vigorously if you see it again a second time. Now what you can do is, by making selective changes to your stimuli, you can try to figure out, well, what is it about that second look that is considered a been there, done that experience by the brain? Let me give you an illustration. So here we are. So you see this guy's face. You show the exact same picture. The activity goes down the second time. Well, what happens if you change the expression on that guy's face, but you don't change that the fact that it's his face? Okay. Well, nothing happens. You still get adaptation. Change the expression again. Same adaptation pattern once more time. This means that this area of the brain that you're measuring doesn't care about facial expression. As far as it's concerned, as long as it's the same face, it's the same stimulus. It's the same man, it's the same stimulus. That tells you that this area of the brain doesn't like just faces, but it is an identity-specific coding that is going on. It is not an area that processes facial expression, because if you change expression, it doesn't care. It doesn't realize that there's something different about the stimulus. Okay? So that's the logic of fMRI adaptation, trying to figure out what exactly is being encoded. Multivoxel pattern analysis is something new in the field. This is, some of you may have heard this in the news, this is what they call the mind reading strategy. The idea here is you're saying, well, so I know activity goes up and down, but when we talk about this area, we're not really just talking about one little thing here. It's actually a bunch of voxels, right? Imagine that this is actually an array of voxels kind of like this, and that in those voxels, you show them a face, some voxels light up, some don't. Well, does that pattern of activity, if black is no activation and white is a lot of activation, does that pattern tell you something about what the person's seeing? Okay, so for example, you can imagine this, where every time it sees a face, it has a pattern that looks kind of roughly similar. But if you show it something like a car, the pattern of activity around that array changes. That tells you that cars are being represented by a different pattern in that area than faces are. So this is telling you something about what we call representational content. What is it that's going on? So after a while, you can figure out, the mind reading aspect comes in that if after a while, when you figure this out, if you see a pattern like this, you can tell ahead of time that, you know what, that person at that moment was looking at a face. And if you're right, that means that you have got a successful pattern classification. Well, so you might be able to do this, but what we really want to know is whether it can even do the same thing if it does this. Maybe it always gives this kind of pattern when it's looking at Archie Bunker's face, whereas with Herbert Truman, you get this kind of pattern. That would be an even better, more specific kind of pattern going on in that part of the brain. And that's kind of where we're trying to take the field now, is to try to find out how specific is the representation in these various areas. Okay? I'll skip this. This is just an example of some of the data that we have looking at faces versus objects with pattern classification. Now, so that's fine. So MVPA and fMRI adaptation are two different strategies that can be used to try to tell you, well, what exactly is this part of the brain looking at and trying to process about the stimulus that you're showing it. Okay. Functional connectivity is a slightly different thing. What we're trying to do here is go back to that question, well, you know what? We see a bunch of areas lighting up. Well, so you see a bunch of areas lighting up. What does that mean? One thing that you might think about, well, that must mean that all these areas are involved together. But just because they all light up doesn't mean that they're all working together. And what this is trying to do is trying to figure out, is that true or not? It tries to find out whether variations in bull signal correlate across different regions. If every time the activity in one area goes up and the activity in another area goes up, every time the activity in the other area goes down, the other area also goes down, and they follow each other together, the activity is correlating. They're synchronized. And if they're synchronized, that's much more likely to be the case that they're working together rather than that they're working independently. That's what functional connectivity is all about. And there are many different methods, data-driven approaches and a hypothesis-driven approach. What this means is that you use the whole brain. You're not kind of going in there with some sort of bias as to what could be working together. Hypothesis-driven means that you pick sites that you think are important, and then you try to limit your analysis to that. You get more statistical power here, but you limit yourself because you have a lot of a priori assumptions you're bringing to the table. Even connectivity is a slightly different thing. This is a Granger causality model, mapping technique that we use. The idea here is to say, okay, I'm not interested only in do these things work together synchronously, but what I would like to know is, does activity in this area precede activity in another area? So a Granger causality would mean that if you get a pattern of activity from X in area X, if it looks like knowing that pattern can help you predict the pattern activity that you're going to see at Y, and sometime in the future, that means that X is partly causing what's going on in Y.
Dr. Jason, you have to hurry up, please.
So that's what you want to try to do. You're trying to see not just are they synchronous, but does one precede the other. And here's an example of what we've been doing to show you this. If we look at these controls here, we look at these three different areas. How are they projected to each other? When you look at faces, the SDS is driving the FFA and the OFA, and the OFA is driving the FFA. If we look at expressions, expressive faces, same sort of pattern with the addition of a bit more backward flow in this direction. If we now switch to showing them objects, you get a very different pattern of connections. You get the LOC driving the FFA, not the OFA, and the SDS driving the FFA. This shows you how these connections between these areas change depending upon the kind of stimulus and task that they're seeing. It's looking at how networks work rather than just a single area light up or not. So, to summarize, fMRI is a powerful tool that has the best spatial resolution for telling us what kind of parts of the brain are doing what. It can show us which regions are activated by certain visual stimuli. It can tell us a little bit about what's going on and represented in different areas. What specifically does this area of the brain like about faces, about moving objects, and so on. And it can also show us how these networks work, whether they're working together or independently, and even can we get a sense of the direction of information flow and index of causality. Okay.